Hello and welcome to Clinical Exam Series with Dr. Piru. Today I want us to discuss the perfect case. Now, the perfect case does not actually exist, but is a helpful guide, especially when you are preparing for traditional clinical examination. The grading of your traditional clinical examination is likely going to be in three aspects: the presentation of your clerking and your physical examination, as well as the discussion of the management of the patient with whom you have interacted with, and then other discussions that might ensue after the interaction with the examiner. The perfect case is going to focus on how to report your examination findings. From experience, I can tell you this: the confidence and the fluency with which you present your examination and clerking is going to determine how often you'll be stopped during your presentation. And the less often you are stopped during the presentation, the better your chances of completing the presentation of your clerking and physical examination, as well as even going forward to discuss management plans with the examiner. So this is something you should get acquainted with. And also, if you're interested in examination stations, clerking station, and OSCEs and procedures, then do well to subscribe to this channel because there is a lot of content regarding that. Now, this is an imaginary case of a 25-year-old who is in perfect health. This is how to report the examination findings of this patient. On examination, I found a young man who is conscious, not in any distress, not pale, anicteric, acyanous, afebrile with an axillary temperature of 36.8 degrees centigrade, not dehydrated, no significant peripheral lymph node enlargement, no finger clubbing, no pedal edema. Urethral catheter in situ draining about 300 ml of clear colored urine. Cardiovascular system examination. The pulse rate is 72 beats per minute, regular, full volume, synchronous with contralateral pulse and femoral pulse. There's no thickened arterial wall, there's no locomotor brachialis. The blood pressure is 120 over 80 millimeters of mercury. The jugular venous pressure is not elevated. There are no signs of precordial hyperactivity. The apex base is located in the fifth left intercostal space mid-clavicular line. First and second heart sounds were heard. Respiratory system examination. Respiratory rate 16 cycles per minute, SpO2 98% in room air. The trachea is central, equal chest expansion, normal tactile fremitus, normal vocal resonance. There is resonant percussion note in all lung zones. Vesicular breath sounds with good air entry in all lung zones. Abdominal examination. The abdomen is flat, moves with respiration. The umbilicus is inverted. There is no area of tenderness. The liver and spleen were not palpably enlarged. The liver span is about 10 centimeters. The kidneys were bilaterally non-ballotable. No demonstrable ascites, no demonstrable asterisis. Digital rectal examination. There is good perianal hygiene, normal sphincteric tone. The rectum contains soft stool. The prostate is rubbery in consistency with symmetrical lobe and preservation of the central sulcus. The rectal mucosa moves freely over the surface of the prostate. Examining finger is stained with brown colored stool. Nervous system examination. The patient is conscious and alert with a Glasgow Coma score of 15. Is oriented in time, place, and person. There's no signs of meningeal irritation, normal skull and spine. The pupils are equal, round, and reactive to light and accommodation. There's no focal neurological deficit. Normal tone and reflexes across all joints. Power is full in all muscle groups. Now, this is how we go about reporting what we call a perfect case. Being acquainted with the flow and the arrangement is going to be very important. Don't forget, whenever you are presenting your case, make sure you start presenting with a disease system. Once again, this video is part of a clinical exam series containing OSCE stations, clerking stations, picture tests, and the common cases that are usually asked in your exam. If you are interested, please do subscribe and leave all your comments below.